Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Daryna Bahriy. She's an internal medicine physician in the Ukraine. And today's Kevin MD article is How Ukrainian Doctors Kept Diabetes Care Alive During the War. Daryna, welcome to the show.
Hello, thank you.
All right, so why don't we start by briefly sharing your story and journey and then talking about why you decided to share this article on Kevin MD.
Thank you. I am originally from Ukraine, where I trained and worked as a physician. I focus on internal medicine, especially on chronic disease, like the most I work with diabetes. Medicine is always been not about just career for me, it's about calling. And I worked in regional clinic where I treat patients, where I educate them, I organize some training so they can improve their life with this chronic condition. Also, my passion was evidence medicine and like prevents medicine, public health. It was I worked before war,
Mm-hmm.
but on February 2022, everything changed. So one day I was reviewing lab results, speaking with patient, like scheduling the training. Another day I was trying to figuring out how to keep patient with diabetes alive during massive disruption during air raids that shook our city. So I'm living in United States and I continue to reflect those experience and I would like to share.
All right, so why don't we go ahead and do that? You talk about that in your Kevin MD article. Talk to us about what it was like during that time in Ukraine during the war and how it affected you as a physician. Tell us about your article.
Yes, so thank you for question. So days before war feels like calm before storm.
Hmm.
Everyone was talking about possibility of war, but no one really believed it would happen until it suddenly did. So I remember that morning. I believe everyone remembers that morning when we figured out, even night, that it happened. We had a lot more patients that time because people were fleeing from the most dangerous part of Ukraine to our region. I live in Western Ukraine, and it was peaceful as it possible to be peaceful in war. So people were arriving, and insulin warehouses were destroyed. Usual distribution medical chain were collapsed. So we don't have enough medication, we don't have enough insulin, and people were panicking. So in those first day, medical team across our region was trying to locate available stocks of insulin and other medication and build chain to relocate it to another clinic, to another city, to shelter, to relocate it where it needed to be. So humanitarian organization give us a huge help, but coordination on the ground happened in real time, often under air raids, and it was how it was. Also, we was trying to teach patient to be peaceful, what to do in situation when they stuck in bomb shelter, when it's not enough food, water, medication. So they know how to use insulin in this situation, how to keep calm, how to monitor symptoms, what to do if it's become enough peaceful, they can go to clinic and find insulin, find medication as soon as it possible. So writing this piece for Kevin MD, it was both like emotional and healing for me. I never thought that I'm gonna have like this experience in my life, but it shaped me who I am today. And I'm really grateful to have this possibility to share my story with you and your audience.
So tell us what it's like for patients to, like you said, sometimes they have to receive insulin in the setting of air raids or in the setting of being in a bomb shelter. And you said as a physician that you had to give them advice in terms of how to manage their diabetes in that war setting. So, what kind of advice did you share with them?
First of all, it's to be calm. Panicking, it's not okay in any situation, and also panicking increase glucose level in blood. All we know it. Also, we spoke how to use insulin. So if you don't have enough insulin and you don't know how much time you're gonna spend on bomb shelter, you need to use it like carefully, a little bit, as soon as you can keep your glucose level not in the like normal level, but in not critical level. So you can keep going long time, but not in perfect situation. Also with food, if you have no food, so try to use a long-acting insulin a little bit, not a fast-acting with no food. Also drink water. If you have water, drink it in small sips so you can stay hydrated as long as it possible. Also, when it's become safe, go to nearest clinic to visit doctor. Also, a lot of patients come and they had like one type of insulin using all their lives. Right now, we don't have this insulin. We need to use another insulin. And patients were panicking. All situation were like totally terrifying, and no one want to change insulin in one day. Because people used to use it like 10 years, and they were so like pissed off, like stressful. So we're trying to keep calm, explain how we did actions, that it's similar, that it's okay for you to use right now. You can come back when it's gonna be peaceful. We will find more. Like humanitarian organization gonna help us. They're gonna send us insulin. To be honest, at the end, when it's become peaceful, a lot of people start receiving better insulin.
Hmm.
So we change something. So people who use long-acting active insulin twice a day, you know this, and I don't know how it's in English. We become to using like Detamir, Levemir, like beta insulin, and they even were thankful for that experience that they did this step forward to change something in their life, in their treatment.
Tell us what was going through your mind as you, as a physician, were treating patients in a war setting, knowing that your own life was at risk during that time. What were you thinking as you were seeing patients in the clinic? What was going through your mind?
So I was thinking about my daughter, to be honest, because I went to work and left her at daycare. It was all day air raids, and she spent a lot of time at basement. And this basement was never meant to be basement like for kids. It's like technical room.
And what continued to motivate you to go in and see patients in a clinic instead of spending time with your family and daughter during that time?
I understand I have no way to stay in basement. I need to work. I need to help. It was heartbreaking that she stayed, but I understand that it's safer for her to stay there than go like to stay like at home with me, because at home we don't have basement. It was not like basement in United States. It was technical room where was some supply. It's never was meant for people to live there to spend their time. So I understand that she need to stay there for her safe. She don't understand all situations. She was just 3 years old. Her teacher give us update what they doing, how they going on, and still working because I understand situation, I understand patient, I understand that I need to be here. I am necessary here. I am useful here. A lot of my coworkers that morning just left our city and go to the most dangerous part of Ukraine to give help, like surgeon, traumatologist, people like my coworkers with who I spoke like every day. They just left the day and go to that part to give like help that was the most necessary, first help after injury of soldiers, people. So I understand that for them it's the most stressful, and then for me stay here and do here. It's air raids, but it's still we working, we treating, we doing what we need to do on our place. So everyone was doing the same. My sister is pharmacist and she also was working all day. Her kids were at school, at daycare. So we all do what we do. And I understand that leadership it's not from top leadership. Leadership is local, from local doctors, nurses, volunteers. You just need to act to save life, to be on your place, you know.
So tell us about the healthcare workers who were among the casualties of the war. How many of your colleagues do you know personally that you've lost?
So from our clinic, thanks God, we don't lost any person, but my friend from childhood, we like play together, we study at different university, but always be in touch. He died in first day of war because he was surgeon and he went to the most dangerous part to give help, and she died from air raids, from drone. All team that was on way to this place where they need to be located, all team died in one moment.
So tell us what the situation is now. What's it like now in Ukraine for healthcare workers? The war has been going on for several years now. What kind of stories are you hearing from back home in Ukraine?
So right now, it's as as normal as it can be normal during war, because still it's air raids. And at hospital I work at small clinic and small town, we don't have basement, if we don't have possibility and staff to move everyone during air raids to safe place basement. It's just impossible. So people stay working, still helping patients, nothing changed. But when you have like breakout, when we have at winter before last year, we had a lot of time when we don't have enough electricity, and it was stressful because when you go into operation or through another medical procedure, that is just it's not just necessary, it's just life or death to have electricity. So it was stressful, but we are adaptive people, we just have some stuff to keep working. We have generator to keep having electricity, backup plans. Right now we are like trying to handle it, but first it was, I wish we had prepared before. I wish we had backup plans before. We have emergency delivery road. I wish we have some stockpile for medicine. But right now we are doing okay, as you can say okay on this situation, because situation is totally not okay, but people are working on their places and trying to do their best. I know a lot of people who leave Ukraine, and I'm as well. I was working 1 year during war, and then I decided that for safety for my family, for my daughter, we need to leave, because it was days where my daughter spent like whole day in basement. It was heartbreaking. So we decided that we need to leave. We come to United States, and we're very grateful for this possibility to be here. I was working online with my pension consulting, but right now I'm starting to prepare to USMLE to become doctor here in United States.
You said that this whole experience about practicing in a war setting in Ukraine changed you as a physician. How did it change you?
So, before I was like, I don't know how to change me, not just physician, but also as a person. I will never become same before, and good it or bad, I don't know. I just become mm, like more peaceful. I have like less great joy in life, but I am enjoying small peace in life right now. Before I have like dreams to become like someone, I don't know, to be someone on the top. But right now I understand that I don't need it. I don't need it to be top to change something, to be matter. You just need to be on place where you are and do the best what you can do, and it's very important. You don't need big stuff in your life to be happy. You don't need big stuff, big like supplies and everything at work, what I really wished, because we had like really regular hospital. We don't have a lot of stuff that I wish we had. Right now, I understand it's all not such important as it was for me at that time.
What's the message that you want listeners and readers of your article to remember? As we mentioned before, the war has been going on for years now. Sometimes that means it gets pushed back in a news cycle. Now, for those people who are listening to you now, what's the message that you want them to hear?
So I want to say that adaptability saves lives. Protocols are important, they are very important, but flexibility is critical when everything changes. Leadership is local. You don't need a big title to change something. You just need to act. Communication matter even from time to time more than medication. You need to be on your place to support your patient, not just by medication, but by your humanity, your word, and take care of caregivers. Doctors and nurses under stress also need support, or all system can collapse. And advice as a human, be grateful for your life right now, enjoy your life, feel everything that you have right now. Don't wait till some time to do something, just live your life now.
Tell us the emotion that you're feeling for having to leave Ukraine under these circumstances. You were a physician in Ukraine, and you mentioned now you're in the United States studying for your USMLE in hopes of being a physician in the United States. Tell me the emotion that you're feeling about being forced to leave your home country.
To be honest, I feel guilty that I left. I feel guilty because I know that I can still working, still helping at that place there I was. But our life, it's not only work, it's also family, and you need to balance between all this stuff. So the main emotional, it is guilty, and I working under it. But I hope that I can improve my skills here. I become doctor here, and I'm still gonna help in Ukraine. I'm gonna work in tirelessly with my colleagues, with hospital where I used to work to help them improve some stuff they have right now.
We're talking to Daryna Bahriy. She's an internal medicine physician from the Ukraine. Her Kevin MD article is How Ukrainian Doctors Kept Diabetes Care Alive During the War. Now, I'm going to end with asking you just some take home messages that you want to leave with the Kevin MD audience.
Medicine, it's not just about treatment. Medicine is about leadership, foresight, communication. And it doesn't matter where you work, at war zone or at peaceful clinic. Remember, your leadership and your humanity are as much important as your prescription.
Well, thank you so much for sharing your story, time, and perspective. And thanks again for coming on the show.
Thank you. Thank you so much for advice, for asking me. It was really nice to speak with you, and it was really healing for me to share this experience. Thank you so much, Kevin.
And thank you so much for sharing.